What's up, guys? How's it going? This is Cade Moore with More Muscle. Today we're going to be doing some newborn tests. Very hard class. I think it will help you with your knowledge, and we're going to get going on it. We're going to do some 5 questions. It might take about 5 to 10 minutes. We'll get started. Guys, these questions are a little bit intense, so if you're younger, don't watch this video. But let's get to the questions. A nurse is preparing to obtain a newborn's temperature. Which of the following methods should the nurse use? Axillary, temporal, tymphatic, or rectal. So these are all ways to, take temperatures. And the correct answer, guys, is axillary. An axillary temperature is the most accurate and safe way to obtain a newborn's temperature. The nurse should check the temperature after obtaining respirations and pulse, since the baby may cry or struggle when the nurse holds the arm in place. So guys, axillary is under the armpit. So you want to be taking a baby's temperature under the armpit. That's the safest way, and that's the most important. Those other ones you don't want to do. The next question. So a nurse is assessing a client, 34 weeks gestation, who has mild placental abruption. Which of the following findings should the nurse expect? Increased platelet count, A. B. Fatal distress. C. Decreased urinary output. D. Dark red vaginal bleeding. The correct answer is D, guys. The nurse should expect this client with mild placental abruption to have minimal dark red vaginal bleeding. So yeah, we'll get to it. That's pretty obvious. Placental abruption, that's when the placenta breaks. You're going to have some blood. So fatal distress is maybe true. Increased platelet count, no. Decreased urinary output, absolutely not. So anyways, you might have a little bit of fatal distress, but it's mainly focusing on the dark red vaginal bleeding. So next one, let's go. A nurse is planning to educational sessions for clients in a childbirth class. Which of the following findings should the nurse plan to instruct the clients to report immediately? So the first one is vaginal leukorrhea. The second one is shortness of breath. The third is swelling of face and fingers. And the fourth is D, and that's lower back pain. So the correct answer, guys, is swelling of the face and fingers. Swelling of the face of fingers or area over the sacrum is an indication of hypertensive disorders such as eclampsia. The nurse should ensure these educational sessions include instructing clients about reporting such indications to their provider. Guys, so swelling of the face and fingers, guys, that can indicate hypertension. And guys, preeclampsia or eclampsia, guys, these are very serious, and it can cause problems for the baby and the mother. And with preeclampsia, let's go with eclampsia first. Eclampsia is when it's prone to seizures, or you're going to have a seizure, because the blood pressure is so high that you can get seizures. And then preeclampsia, you'll have like protein in the blood, severe headaches, difficulty breathing, and sometimes, guys, this can indicate a need for getting that baby out as soon as possible. So you don't want to have preeclampsia or eclampsia. So the correct answer, guys, is swelling of the face and fingers, guys. That's in serious. That could mean hypertension, and that's what you want to report. And you want to if you have that, you want to go to the hospital immediately. Next one, okay. A nurse is teaching about preventing engorgement to a client who is planning to use formula to feed her newborn. Which of the following instructions should the nurse include? Apply ice packs to your breasts. Hand express milk from breast 3 times daily. Try to avoid wearing bras as much as possible throughout the day. Request a prescription of medication to suppress lactation. So the correct answer is A, guys. Engorgement is like basically swelling of the breasts, and that's not something you want. So you want to apply ice packs to the breast, and that's going to reduce discomfort. Okay, the next question, guys. A nurse is caring for a pregnant client who's 37 weeks gestation and who had a biophysical profile with a total score of 4. Which of the following actions should the nurse anticipate taking? Prepare for delivery of the infant is D. C is perform an amniofusion. B is administer betamethasone. And A is discharge the client to home. So, guys, the correct answer is D. Prepare the infant for delivery, guys, because a score of 4 is meaning that they're having maybe some respiratory distress, they're having some problems. So you want to prepare the prepare for delivery, because that could be a problem. Delivery is considered when a biophysical profile score is less than 6 or lower, and is attained after 36 weeks of gestation with a 4 or lower. So guys, hopefully you learned something. This was a more intense topic, but anyways, thanks for watching. Subscribe.